Hi, Autumn. Good morning, Dupai. Dupali. Sorry. Shelly. I just want to warn everyone, if you hear a big whomp, we have large amounts of snow coming off our roof this morning. It's very warm here. Hi, Lori. We're going to try to get started on a timely basis this morning, just because it's quite a large webinar. But we're still waiting for quite a few people, so we'll give it a bit. Hi, Rula. Just going to give it about 2 or 3 minutes. We have quite a few people registered. Can everyone see this screen? Can you see the presentation? Title page? Awesome. Thank you. Thanks. Good. All right. I think we're going to get going only because this is quite a long webinar pertaining to the subject of bloodborne pathogens. So good morning, everyone. I'd like to welcome you and thank you for attending our infection control webinar, Creating a Bloodborne Pathogen Exposure Control Plan. Sorry. This is a pretty in-depth webinar, and today we're going to explore the why and the how. There are documents that are going to be sent to you, and they are, sorry, I have them here. The OSHA Bloodborne Pathogens Exposure Control Plan template. There's also a Bloodborne Pathogens reporting form and a post-exposure packet. They're all templates that you are welcome to go through and have a look at once we're done. I'm not going to have time to review the documents with you today. And if you have any questions, please send them to infection control education. Sorry, that's wrong. Infection control at cbongroup.com. I'll type it in here. And someone will help you with any of your questions as soon as they possibly can. Alrighty, let's get started. What is a bloodborne pathogen exposure control plan? A bloodborne pathogen exposure control plan, or BBPECP, crazy, right? Is an in-house study that focuses on identifying and defining how exposures to blood, bodily fluids, mucous membranes, and other potentially infectious materials are likely to occur in the workplace. It can also be considered a plan of action as it identifies and explains the control measures that have been established to prevent or reduce the risk of these exposures. Regulatory. We all know that word. As part of the effort to provide a safe working environment, Environmental and Workplace Health Canada requires that a plan be in place which demonstrates how to reduce the risk of exposure to bloodborne pathogens in order to protect those who may encounter such exposures as part of their official duties. So Environmental and Workplace Health Canada requires it, and so will your provincial or territory authority. As well as your authorities requesting it, we should be committed as well to providing a safe and healthful work environment for ourselves and our workers and for our clients. And not knowing how to write a plan is not an excuse. The criteria for a bloodborne pathogen exposure control plan determine how a worker can be exposed and implement methods of exposure control by using universal precautions, engineering and work practice controls, personal protective equipment, housekeeping controls, record keeping, communication of hazards, ongoing education, hepatitis B vaccines, post-exposure evaluation and follow-up, and procedures for evaluating the circumstances of an exposure incident. All of those that I have just sent to you are included in the documents that you will be getting today. So please don't feel overwhelmed. It is a large request, but it's easy enough to do if you follow the proper steps. Implementation. Once you have developed a bloodborne pathogen exposure control plan, you then have to implement the plan. But not only that, you have to assign someone or people to help ensure that that plan is kept in place. So you will need to assign clearly defined roles and responsibilities to those people to oversee the plan. Administrator responsibilities are to maintain, review, and update the plan annually and whenever necessary to include a new or modified task or procedure, to develop and implement bloodborne pathogen awareness training, to educate managers and workers on an ongoing basis. Oh, my face not working. To manage the hepatitis B vaccination program, and we'll talk about that in a bit, to determine and stock personal protective equipment, to implement new or additional processes that are requested by your local government and your regulators, such as your public health department, to ensure required records and forms are kept and to review them as needed, such as ongoing training is required annually, and to manage worker-client post-exposure procedures. Management responsibilities are to implement the plan to all departments, perform record keeping, such as SHARP's inventory records, hepatitis B vaccination records, including right of refusal records, exposure reporting forms, and SHARP's injury logs, as well as to create hygiene facilities complete with decontamination and restocking protocols. The bulk of the responsibilities will go to your management position. The administrator is someone who will oversee that the manager gets all the work done. Management's responsibilities also include creating a list of hazards and risks for each service offered at the location. We covered this in the risk assessment webinar on January 13th. It's an easy process to do once you understand the steps. And once it's done, it only needs to be amended if something in the service changes. So please, if you're interested in risk assessment, go back to January 13th on either YouTube or on our infection control education website. It's there, and as are all the documents that you need for that. Create written infection control protocols and service procedures. Oversee and encourage safe work employee operations. Schedule necessary bloodborne pathogen training. Set dates to review the plan at least annually. Now, the plan has to be written for each specific location. So, for example, if you're an owner of a chain spa, each location must have its own bloodborne pathogen exposure control plan. If you are a distributor and you're educating, for example, microblading, and you have more than one location and you're going to offer microblading at more than one location, you have to write a plan for each location. A bloodborne pathogen exposure control plan must be customized to incorporate your company's specific workplace location by reviewing the hazards and the risks, operating procedures, work site tasks, infection control procedures, and hygiene monitoring and controls. And it doesn't matter what your field of work is. Exposure happens in all fields. Don't think that it doesn't. Exposure can be determined by evaluating which workers will be or have the potential to be exposed to bloodborne pathogens by noting the reasonably anticipated risk of exposure. All of this is also in your risk assessment. We have to remember that this is just not COVID related. There's lots and lots of infectious diseases out there, and we have to be careful, especially if we are exposing ourselves through any kind of bloodborne bodily fluid, mucous membranes, other potential infectious material exposure. Reasonably anticipated risk of exposure is identified through the use of sharp objects, through exposure to blood, through other potential infectious materials, through the mucous membranes, or by the administration of first aid. And sometimes we forget that that's part of it as well. We should have a first aid administrator on site, and we should make sure that they are protected. First, you need to determine the exposure. Determine the fields of work that have potential for exposure, and determine the types of services offered by those fields. Once again, this is your risk assessment, and this is how it correlates with your bloodborne pathogen exposure control plan. The following lists are examples of where exposure may reasonably be expected to occur in the beauty industry. Here's some fields of work. These are examples only. There's lots more. I'm sure I have not listed all of them. But hairdressing, barbering, esthetician, nail technology, foot care specialist, microblading tech, lash and brow tech, hair removal specialist. It doesn't matter whether it is threading, waxing, sugaring, laser, electrolysis. It doesn't matter. Piercing specialist, tattoo artist, micropigmentation tech. There you go. Threading specialist, makeup artist. Individuals performing exposure risk services should be highly encouraged to participate in all aspects of the bloodborne pathogen exposure control plan. If you're offering these types of services, please do your risk assessments and include them in your bloodborne pathogen exposure control plan. This is what the risk assessment looks like. It must be completed for each service. As you know, it goes from critical, semi-critical, all the way down to single-use disposable. And that, of course, was covered in that webinar as well. So let's get down to what we're talking about today, which is bloodborne pathogen exposure control plans. First, you need to use your universal precautions. Universal precautions are an approach to infection control that treats all human blood and all other potential infectious material as if they are known to be infectious. So if you're doing someone's legs and you're waxing them and you see clear fluid or blood come to the surface, that is a blood exposure. We have to assume that that blood is known to be infectious and take universal precautions to stop that, such as wearing PPE, wearing gloves, proper hand hygiene, etc., etc. If you've taken your fundamental infection control program, you know exactly what your fundamental precautions are, and we've all taken them in school. So if you don't know what they are, revisit them. All employees are responsible to practice universal precautions when performing a service. Just write them down and include them in your plan. Decontamination and disposal protocols for spills. Spills can be as little as if you have an extraction and you hit a vein and blood is on the table. That is an exposure. A little drop of blood, that is a spill. And we must have protocols on how to clean up all types of spills. Where we work today can be dangerous. We don't know what kind of spills we could come across. I mean, there's been some pretty tragic incidences in Vancouver, and I'm sure across the country. For beauty professionals, we have to be sure that we can protect ourselves, and we also know how to clean up spills. So protocols for spill cleanup include what PPE is required, the supplies and equipment required to clean up the spill, procedures for decontaminating the spill, procedures for decontaminating reusable equipment used to clean up the spill. I know that sounds confusing, but it's like a bucket. If you're using a bucket and a mop, how are you going to clean the mop head? How are you going to clean the bucket? Those are also the reusable equipment used to clean up the spill. It could be as much as looking after the garbage can as well. And hand hygiene, what is proper hand hygiene to use before and after the spill, and protocols for biohazard exposure. So if you've been exposed to blood, what are your biohazard exposure plan? Disinfectant requirements. I bet a lot of you didn't know that you actually do have disinfectant requirements. Quite frequently, health departments tell you to use alcohol and bleach. As we know, those are absolutely not acceptable, and we know the reasons as to why. So, in your bloodborne pathogen exposure control plan, ensure you have protocols for disinfectants used. Ensure they are hospital grade, Health Canada registered, designated for use with HIV and Hepatitis B pathogens, and more, but those two in particular. Decontamination and disposal protocols pertaining to each category of risk. So ensure that they are able to handle, the disinfectants you have on hand are able to handle critical, semi-critical, non-critical, single-use sterile, and single-use disposable items. Ensure your disinfectant label demonstrates manufacturer directions for use, and that it clearly includes the PPE required for the worker to perform the task, the protocols for blood spills, removal, cleaning, and decontamination, contact times required to kill specific pathogens, including HIV-1 and hepatitis B, and directions for disposal of the contaminated material. All of that should be included. I don't have a preempt one on your label from your manufacturer. They are all there. They're precautionary statements and proper directions for use and what to do in case of an exposure. They should be on your disinfectant label. Make sure that they are. Engineering and work practice controls. These are essential components to reducing the risk of occupational exposure to bloodborne pathogens, and they're used to minimize the risk of exposure. Engineering controls identify equipment, devices used in the workplace. They should be evaluated annually and implement safer equipment and devices. If that doesn't make sense, let's redo this. Engineering controls identify the equipment and devices that you use in your workplace. So if you are doing microblading, you're using microblading pens. Are they disposable? Are the pens disposable? Are they single-use items? Are they decontaminable? All of that is important. And on a yearly basis, you should go back and take a look at the equipment that you're using and the devices that you're using and evaluate if they are the correct ones to be used. If they are changed, then you should change your protocols as well. Ensure the equipment and devices that the manufacturer's operating manuals are on file and that they cite safety procedures and proper use and recommendations of proper care for maintenance It's really, really important that all manuals are kept on file and that employees know where all the manuals are and that they are available, because you never know what could happen. Keep the records of all maintenance on file with your file for that particular piece of equipment or device. Work practice controls include keeping inventory of sharps, including the expiry dates, because it's always first in, first out. We want to make sure that that, in fact, is what's happening. So keep a list of your sharps, keep a list of their expiry dates. Create lists of locations of acceptable hand washing facilities and the protocols for their decontamination and stocking. All of this has to go in the manual. I know it seems redundant or silly, but if you list in your manual, well, we have a hand washing station in this location and a hand washing station in this location, and these are the procedures for decontaminating it, and these are the procedures for restocking it. If any government official comes into your place of business, they're going to be pretty impressed that you also include this. That way, your workers also know, and you also know what is expected and what is required to restock it, and you won't ever be out of stock. Create a sharps protocol. This is really important. As a distributor, we taught microblading. It was a brand new procedure on the market, and it was brand new to all of the employees in the distributorship. They all had to learn what was required. Part of the requirement was sharps containers. Part of the requirement was to ensure that the sharps containers were being used properly, were being emptied on by the time they were so full, and where to take them to empty them, where to take them to replace them. Was bloodborne pathogens training required? All of those little things that we don't think about. So work practice controls are important. Keep sharps protocols. List your proper type of container. List the proper use of the container. Is it mounted to a wall? Is it kept on the lower shelf of the trolley? Like, it's really important that we know where the proper use of the container is. Proper disposal of contaminated or potentially contaminated needles, glass, or other sharps. Proper methods of disposing dropped or broken sharps, including what to use and what not to use. Things get dropped. People drop them, whether in a service or whether cleaning up for a service or before a service. So it's okay to use a pair of tweezers or forceps to pick up needles, but it's not okay to use a vacuum cleaner. And sometimes we just have to make sure that the more information we have, the better knowledge we can share and less accidents will happen. Include protocols on how to perform services involving potential exposure to blood or other potential infectious materials. Include protocols for the examination of implements, tools, and equipment that may become contaminated with blood or other potential infectious materials. If, for example, if you put something out on your trolley and you perform a high-risk procedure, but you didn't touch that one implement, does it have to be decontaminated? Does it have to be disposed of if it's single use? Yes. But some people take shortcuts and they say, well, I didn't use this, so I'm just going to put it back. But the potential for exposure was there, and now it's been contaminating everything else that you've already decontaminated. So please write down procedures for the examination of implements, tools, and equipment that may become contaminated with blood or other potential infectious materials. When those items are taken to the decontamination area at the sink, they should be checked to make sure if they have blood or other potential infectious materials on them, because the cleaning procedure is different, right? So make sure that they are examined. Protocols regarding type of disinfectant required pertaining to the category of the object requiring decontamination. That's again on your risk assessment: critical, semi-critical, non-critical. Okay. Protocols for worker use of equipment following the manufacturer's recommendations and guidelines for proper operation, care, and preventative maintenance. Protocols for disposal of biohazard waste. This is a crossover. We're going to talk a lot about certain protocols. They're going to fall into different categories. Work practice controls and biohazard waste are important Also, we talk about disposal of biohazard waste in spill protocols. So it's not as confusing as you think, because once you write a protocol for one certain thing, such as disposal of biohazard waste, you can include it in whatever area it needs to be included in. Protocols regarding eating, smoking, drinking, or application of cosmetics, applying contact lenses or lip balm on the work site. PPE controls. PPE is available to the worker at no charge, period. PPE is available in all the appropriate sizes, period. PPE is readily accessible. And where is the locations of the PPE? So are you going to keep one inventory of PPE and have that particular treatment room stock their PPE? Or, as I would suggest, you keep it in one area and it is drawn for each service. But it's up to you how you do it. And you need to list how it's done. Protocols for PPE that is required to be worn for each service. So yes, if you're wanting a mask worn, if you want your hairdresser to wear a mask, that is a protocol. All hairstylists wear masks. If you want them to wear more, then they wear more. Protocols for proper donning and doffing of PPE. Protocols for proper PPE disposal. Protocols for laundering reusable PPE. Protocols regarding contaminated PPE. Now, this can mean that you, how you're going to launder that contaminated PPE, how you're going to dispose of that particular contaminated PPE, or do you send out contaminated PPE to a laundry site? And if so, what protocols do they require for contaminated PPE? Glove protocols, including the use of utility gloves, because we often use utility gloves for cleaning implements and equipment before we decontaminate. Appropriate face or eye protection protocols. Are you wanting your hairdresser to wear a shield on top of her mask? If your hairdresser wears a shield, does she have to wear a mask under it? Of course she does, but I can't tell you how many people I see wearing a face shield and no mask. So what's the point? Housekeeping controls, step-by-step protocols on decontamination methods required for each workstation after a risk service. So if you have someone doing housekeeping for a spa bed after leg waxing, what are the protocols? What are the protocols for someone who is doing housekeeping after a microblading session, or after, you can take your pick, it's all there. What about if a hairdresser in a hair chair cuts her finger with her shears and blood drops onto the chair or blood drops onto the cape? That's exposed. Protocols and procedures for the cleaning and decontamination of contaminated surfaces, list of waste container locations, protocols for disposal of contaminated waste, whether it is regular waste or biohazard waste, and ensure that these disposal methods are in accordance with federal and provincial or local regulations. I know this seems like a lot. Once you get the documents, it'll be a little clearer. All righty. I'm sorry, did I lose one here? Yes. Housekeeping controls also includes a list of sharp container locations. Where are your sharps containers located? Your housekeeper has to know, because if they have to be emptied or changed out, I don't mean emptied, sorry, if they have to be switched out, that will probably fall under your housekeeper's controls. Protocols for handling sharps and sharps containers, including container replacement. Your housekeeper has to know to use forceps or tweezers and not her vacuum cleaner or his vacuum cleaner to clean up broken sharps. Protocols for decontaminating contaminated devices and equipment according to the manufacturer's instructions. It doesn't matter if the technician who did the service is going to be doing the contaminating. It's really important that we share as much information as we can to all workers so that we are accountable to each other. So for example, if you have a disenchanted employee who's lackadaisical and doesn't feel like properly cleaning or rinsing or drying your implements, and the housekeeper or someone else is walking by, they can check that person and say, hey, look, this is really important. You have to follow these protocols. This is really important. You're endangering the health of others. So we need self checks. So the more people that we share information with, the more people that we communicate with, the better every one of us will be, because we're all then going to be accountable to each other. List of acceptable cleaners and disinfectants with their protocols for use. So, as you know, with cleaners and disinfectants, we have to make sure that they do not cause each other harm. Protocols for handling and sorting contaminated laundry, which we already spoke about. Handle as little as possible. Should it be bagged or categorized at the location where it was used? Should it be stored or rinsed in the location of use? It's important that all of this is included in your manual. Protocols for handling wet or leak-through contaminated laundry. That could be wet towels after a perm that somehow got thrown in with something that was contaminated with bodily fluids. It's important that we think about all these things. Protocols for shipping contaminated laundry to another facility. Hepatitis B vaccine. I know a lot of people right now are disenchanted with everything that's happening regarding vaccinations. And I'm not going to expand on that, because I have my own beliefs. I've raised a whole bunch of kids. I have a whole bunch of grandkids. But hepatitis B is highly, highly contagious. So protocols on the requirements for receiving a hepatitis B vaccine is up to the company to pay for the vaccine, and it's the worker's right to refuse it if they do not want to have it. But if you get a hepatitis B vaccine, it's going to save you if you travel and save you from getting hepatitis B, which we can talk about later if you so desire. Post-exposure evaluation and follow-up, which I sent you, you will receive a packet on. It's important that after an exposure, even if it's a client exposure, that you follow up the necessary steps to ensure that everyone has been looked after and everyone is safe. So always keep on hand a list of a worker's emergency contact information. If you have to send a worker to the hospital and you don't have their emergency contact, you can't help that worker in any way or shape or form. They may not be able to tell you who to contact. So it's important that we keep a list. Protocols for identifying and dealing with an exposure. We need to know what those are. Exposure first aid protocols. So if someone's been exposed, how are you going to attend to that? All those protocols need to be written down, and everybody needs to know, because oftentimes in a spill or in an exposure, people panic. So if we have protocols and they're written down and everyone knows where they are and what they are, they will be followed. List of secure transportation options needed when providing travel to the hospital or a medical clinic for an exposed worker or a client. Checklist of what information must be given to the healthcare provider after an exposure, such as, were they vaccinated for Hep B? What is their job description? Do you have a packet of exposure forms that you are sending with them? What were the circumstances of the exposure? You also need to know worker-client bloodborne pathogens post-exposure packet. So start filling out everything that you can. Make sure that you have the documents on file. Make sure that the management on staff or the next person who is in charge is able to find all these documents and knows what to do with them. So let's talk about hepatitis. It's truly up to the individual to do what they so desire. But if you're working for someone else, especially, and you become exposed to hepatitis B, what are your recourses? None. If they offer you a vaccine and you choose not to take it, you're on your own. Hepatitis B is a liver disease caused by the Hep B virus. It's far more infectious than HIV, and it is preventable by a vaccine. Hep B is spread through contact with infected blood and bodily fluids, including semen and vaginal fluid. Sharing personal care articles such as razors, scissors, nail clippers, toothbrushes, cuticle nippers, foot files, I can go on and on. Exposure in the workplace by getting pricked by a needle or a sharp object that has been infected with blood or bodily fluids of an infected person. Tattooing, body piercing, acupuncture when unsterile equipment and techniques are used. Oh, and then we have Hep D, which is a very good friend of Hep B, because once you have Hep B, you are susceptible to getting Hep D. Hep D is a virus that spreads in the human body in the presence of the Hepatitis B virus. You can be infected at the same time with both Hep D and Hep B. It's called a co-infection. You can also readily be ill with Hepatitis B and get infected with Hepatitis D. This is called a superinfection. Hepatitis D is spread through contact with infected blood or bodily fluids. So, for example, if you have Hep B and you don't know, and you are working on a client and get exposed, and that client has Hep B, Hep D, you now have both as well. It can be passed on by sharing personal items. Hepatitis in personal care services also includes Hepatitis G. It's transmitted by sharing personal items contaminated with the virus and other similar behaviors. So Hepatitis G is on items, implements, tools, equipment, countertops, anywhere that has not been properly decontaminated. It can also be transmitted from sexual activities, from a mother to a newborn child at birth, from people getting tattoos, acupuncture, body piercing, or use of tools that are not sterile or properly decontaminated. And it's especially susceptible for people with impaired immune response. So, if you are offering services with the potential for exposure, ensure you are adhering to the Canadian compliance laws. Take a Bloodborne Pathogens Worker Safety course. It's cheap. It's like $40 or $49. It's good for a year. And if you are going to be offering extremely high-risk services such as microblading, it's really worth it. It's really worth it. It's worth it for every single service, but it's especially worth it for those with high-risk services. Any questions? No questions today? Well, you will be sent the recording and documents. Oh, someone's typing. I hope I explained what a bloodborne pathogen exposure control plan is. It has many chapters and subchapters, but it's not that difficult to understand. And once you see the OSHA template for bloodborne pathogen exposure control plan, you'll understand why it's really, really important. It's amazing how it stretches your brain, and you'll really understand how important it is to use proper infection control procedures, use registered disinfectants, and make sure that you know the levels of disinfectant that is required and what your regulatory requires for that disinfectant and what should be on that label before you choose a disinfectant. It's important that we share as much information as possible with all the people we work with and with our clients, so that our clients know that we're protecting them and ourselves and our families. It's really important. Okay, everyone, I want to thank you. Please, if you have questions, here's your email address, infectioncontrol@CBON Group. CBON website is cbongroup.com. All of our educational courses are infectioncontroleducation.com. Roger and out.